The first and most important question any patient must ask their doctor before having dental implants is what specific steps they take to minimize the chances of developing peri-implantitis. Peri-implantitis is a disease that patients develop around their dental implants, and there's two stages to that disease. In the first stage, the gum around the implant becomes inflamed, and in the second stage, that inflammation spreads deeper into the bone and causes the bone to be destroyed. When enough bone is destroyed, the implant can actually fall out of the patient's mouth, and the entire investment in terms of time and money is completely wasted. Peri-implantitis is a much bigger problem than people want to talk about. Depending on which study you read, the incidence is somewhere between 10 and 50%. Think of that, 50%, 1 out of every 2 dental implants may develop peri-implantitis, and that can lead to the loss of the implant. As a board-certified periodontist who's placed over 10,000 dental implants, my belief is to do it right the first time to minimize the chances of people developing peri-implantitis. There are 2 major reasons why patients develop peri-implantitis, the first one being the selection of the implant. Certain implant coatings are more likely to develop peri-implantitis than others. Unfortunately, the most popular implant company, and they're most popular because they have the largest marketing budget, is also the particular implant which is most likely to develop peri-implantitis. This is implant dentistry's dirty little secret, and I don't want to keep it a secret. When you come in for your consultation, I'm going to give you this insider knowledge so that you can be in the know and avoid this dental implant. The other factor in terms of implant design is how the abutment seats on the implant. So there's the implant, the abutment goes on top of the implant, and the crown seats on top of the abutment. Certain implant designs, how the abutment goes into the implant, cause some bone loss, and that bone loss initially can lead to peri-implantitis. The second reason why patients develop peri-implantitis is cement left under the gum after the crown is cemented by the restorative dentist. When the crown is cemented, the excess cement extrudes or squeezes out from underneath the crown, and that can be pushed into the area under the gum. When cement is left under the gum, even a tiny piece which may be invisible to the naked eye, that's an irritant. It's a foreign body under the gum. And that foreign body causes inflammation. That inflammation is the start of peri-implantitis, and that can lead to bone loss. And I must say that the problem has nothing to do with the restorative dentist being careless or sloppy. I've seen cement left under the gum from crowns cemented from some of Long Island's best restorative dentists. It doesn't have to do with their technique, it has to do with the impossibility of removing these minute pieces of cement from underneath the gum. The solution I've developed is the use of the perioscope to look underneath the gum. The perioscope is an instrument, it's like a tiny camera that we can put in under the gum, and it magnifies the environment under the gum 40 times. So think of that. A tiny piece of cement that you can't even see with your naked eye is now enlarged 40 times, and we can see it and we can remove it. So after the crown is cemented, we get the patients back, we look under the gum with the perioscope to ensure that there is no cement, or if there is any cement, we remove it. And by removing it, and by carefully choosing our implant design so that it's an implant surface which is least susceptible to peri-implantitis, and an implant design that's least susceptible to peri-implantitis, I know we're giving our patients the best chance of having their dental implants last a lifetime. I urge you to call my office to schedule an appointment for a consultation. We can discuss how implants can help you achieve your oral health goals so you can smile better, feel better, and enjoy life more.